John inspires me by walking the walk, not just talking the talk, about delivering services for people who need them.
The characteristic that I would, just really highlight is his ability to put people at ease.
He's a great listener. He understands everything and he remembers little details. No matter how busy he is, he's there and he is giving his heart and most importantly, his friendship.
I got into healthcare accidentally. I had a freelance graphic design firm in addition to a full-time day job, and I was asked to design a logo for a health maintenance organization. And then they asked me to do all their marketing materials, which I did. And then my day job was going away, so I told them I had to stop doing this and go look for a new job. And they said, well, come work for us. And I got into healthcare as a sales rep. And 6 months in, I said, this is what I want to do for the rest of my career.
There was a time when, of course, many fewer people had access to health insurance. And then through the Affordable Care Act, we were able to start to address this issue. And LA Care Health Plan is a major part of that solution. And because he is the president and CEO, John Baackes is a major part of that solution.
The funding for residency programs, the funding for debt relief, the funding for those institutions that are serving under-resourced communities, the funding for new medical schools or new medical programs. All of this represents a remarkable commitment to changing the way things are done.
But the things that he specifically responded to was recognizing that there is a safety net that needs to be protected, and that's the county facilities, the FQHCs, and free clinics. But there's what I call the hidden safety net of private doctors who serve large numbers of Medi-Cal patients. And he really recognized how important it was to be a partner to them as much as to the classic safety net. And then most recently, elevating the safety net, which is, I think, a national model that supports the practices that are serving Medi-Cal patients, supports the physicians through loan repayment, and swims upstream to support medical students who are aspiring to make a difference in their career, who often come from groups underrepresented in medicine, providing them with full scholarships.
The biggest problem I think we have going forward is trying to make sure that Medi-Cal is funded at the same levels as Medicare and commercial insurance. As long as there is a disparity in that funding, we're not going to have equality in access, and we're going to not have equality in outcomes. So if we want to address the disparities in healthcare, we have to provide resources in a uniform basis.
Championing the MCO tax was critical for John because I don't think anyone would have stepped forward the way he did. His network of advisors brought us some really talented individuals to counsel us on how we should construct a coalition and what steps we should take to have it become a reality and become a statewide organization, and how to work with our elected officials and the governor's office to achieve a win-win. So that was really important, getting that off the ground.
He is a healthcare champion. He personifies exactly what this award is all about. We would be in a very different place if it wasn't for his efforts, for his work.
He has been a leader not just in California, but in the entire nation, bringing health to communities, understanding how to innovate, not being afraid of challenges, not being afraid of what's to come next.
He truly deserves this award.
He's just a remarkable man.
Mr. Baackes, muchísimas gracias por todo lo que ha hecho. Ha sido un líder para todos nosotros. Thank you so much, Mr. Baackes, for absolutely everything that you have done. You have been an amazing leader for all of us.
On behalf of everyone at Charles R. Drew University of Medicine and Science and myself, congratulations on this most prestigious Lifetime Healthcare Champion Award.
John, I can't think of a more deserving person for this award than you. Congratulations, and I look forward to continuing to work with you.
Not only congratulations and well-deserved, but you are a lifetime healthcare champion. So this award is just icing on the cake. Thanks for all you've done and all you will do.
I'm very humbled to be recognized with this award, and I accept it on behalf of the 2,200 colleagues I work with every day at LA Care, who work to support our members and to support the providers who care for them. Thank you very much.